Fixing leg numbness and swelling after 65. My legs felt like they belonged to someone else until I discovered the real cause. 6 months ago, I started experiencing strange sensations in my legs. Numbness would creep up from my toes, followed by tingling that kept me awake at night. My ankles swelled daily, making my shoes feel too tight. At 67, I assumed this was just aging, until my doctor revealed something surprising. Understanding circulation changes with age. After 65, blood vessels naturally become less elastic. According to the American Heart Association, this reduced flexibility affects circulation throughout your body. Your heart must work harder to pump blood, especially to your lower extremities. Gravity makes this challenge even more difficult. Research published in Circulation Research shows that peripheral blood flow decreases by approximately 10% per decade after age 60. This explains why symptoms often appear gradually, then worsen without proper intervention. My journey to discover the root cause. 3 months ago, I visited my doctor expecting a prescription. Instead, she asked about my daily routine. I spent most days sitting at my desk, then watching television in the evening. She explained that prolonged sitting creates a perfect storm for circulation problems. Blood pools in your legs when you remain stationary. The muscle pump system that normally pushes blood back to your heart becomes inactive. Dr. Michael Williams, a vascular specialist, calls this sitting disease syndrome. Problem number 1. Venous insufficiency development. Leg veins contain one-way valves that prevent blood from flowing backward. With age, these valves weaken and may fail completely. Blood then pools in your lower legs, causing swelling and that heavy feeling. Mayo Clinic research indicates this affects nearly 40% of people over 65. Problem number 2. Neuropathy progression. Numbness and tingling often signal nerve damage. Diabetes is a common cause, but vitamin deficiencies can create similar symptoms. The B12 deficiency, particularly common in older adults, affects nerve function significantly. According to the National Institute on Aging, this occurs in up to 15% of people over 60. Problem number 3. Medication side effects. Many common medications contribute to leg problems. Blood pressure medications can affect circulation, while diuretics may cause electrolyte imbalances. Anti-inflammatory drugs can increase fluid retention, leading to swelling you might not connect to your medication. Simple solutions that actually work. Elevating your legs above heart level for 20 minutes daily helps reduce swelling. This allows gravity to assist blood return to your heart. Do this 3 times throughout the day, especially in the evening before bed. Ankle pumps and calf raises activate your muscle pump system. Perform these exercises every hour while sitting. Flex your foot up and down 20 times, then rise onto your toes repeatedly. Compression therapy benefits. Graduated compression socks provide external pressure that helps blood flow upward. Start with light compression, 15 to 20 mm pressure rating. Put them on before getting out of bed, when swelling is minimal for maximum effectiveness. Dietary approaches for circulation improvement. Reduce sodium intake to minimize fluid retention. The American Heart Association recommends less than 2,300 milligrams daily. Processed foods contain hidden sodium, so focus on fresh ingredients when possible. Increase potassium-rich foods like bananas and leafy greens. Potassium helps balance sodium levels, reducing fluid retention naturally. However, check with your doctor if you take medications, as some affect potassium levels. Recognizing serious warning signs. Sudden onset of severe swelling in one leg may indicate blood clots. This requires immediate medical attention, as pulmonary embolism can be life-threatening. Don't ignore asymmetrical swelling or pain. Changes in skin color or temperature, especially with pain, might signal circulation problems requiring prompt evaluation. Early intervention prevents complications. Exercise modifications for better circulation. Walking remains the best exercise for leg circulation. Start with 5 minutes daily, gradually increasing duration. Swimming provides excellent low-impact cardiovascular benefits, while water pressure naturally compresses your legs. Avoid prolonged standing or sitting. If your job requires either, take movement breaks every 30 minutes. Even simple weight shifts help activate circulation.